Hello, I'm Dr. Berndt. I wanted to talk to you about substance use and substance use recovery. In this country, we see a pervasive pattern of patients or people medicating themselves with street drugs. We often look at this as in very judgmental or moralistic ways, when it might be more constructive to see substance use as an attempt at self-medication. The target for that self-medication is usually either anxiety or depression or some other set of negative feelings. In this country too, we have a war on drugs, which is very expensive. What we should have instead would be a war on depression and anxiety. And the money that we spend on the war on drugs would be much more helpfully spent on the source of the problem, which is a psychological issue relating to depression. So you can assume that when you or someone else is using drugs, and that includes food as a stress management technique. If someone uses drugs, you can assume automatically that what they are doing is medicating themselves for depression. So the appropriate response ought to be the resolution of the underlying depression or anxiety. And that can be done with either medication or psychotherapy or stress management techniques that a patient must learn in order to become free from this issue.
I'm sorry. I'm sorry, alcohol too. You keep saying drugs, and substance abuse is alcohol too.
Okay.
I'm sorry.
Now this applies of course to alcohol as well. In the case of alcohol, patients that suffer from alcoholism usually have a family history. So they are somewhat genetically predisposed to the use of alcohol, but the same precepts apply there as well. It has to do with treating the underlying depression. One of the things that one sees specifically with alcoholism, I've seen in my practice, is that patients have a hard time or are totally incapable of articulating how they feel. So they tend to what's called stuff their feelings. And as a result of that, they store them, they keep them to themselves, and they have just a chronic bad feeling. And the alcohol is a temporary relief from those bad feelings. So just to remove the alcohol without treating patients, or I should say helping patients with new coping skills is not going to do it. Patients must learn some new coping skills. The same thing applies to substance abuse and to the other topic, which is of course overweight, and using food as a soothing mechanism or as an antidepressant, anti-anxiety strategy. So the crucial thing here is the recognition that anyone afflicted by substance abuse is suffering from a background depression and ought to have treatment for that condition. And resolving the underlying depression then can have one think in very optimistic terms about a good outcome.